Hey, agents, Luis Moreno here with Think Medicare, Think ACA. So a lot of agents have been getting certified on the Federal Facilitated Marketplace site, the portal.cms.gov. This is a site where if you live in the state that is utilizing HealthCare.gov, this is where you're going to go get certified. The issue is at the very end of the certification, I'm going to show you when you go check, because you should be checking that you're on the RCL, the completion list. Figure out what the R is for. Registered completion list. Maybe we'll figure it out here in a minute. But when you go to the very end, there's a yes or no. Okay, is it valid? And I'm seeing no for some people. They don't know how to fix that. And so I figured it out. I'm going to share that with you right now. But before I do that, please comment, like, and subscribe to my channel. All right, let's go take a look at what this is. So after you get certified, guys, what you should be doing is you should be going to this site right here, okay? It is the completion list, all right? Now, this thing is humongous. What you're going to do is you're going to plug in your NPN, okay? And then you're going to hit update table, okay? When this happens, you'll see your NPN will populate here. And I've been doing this since 2014, since Obamacare started. And you will see here, individual marketplace registration completion date. And you'll see there, it was completed on August the 8th. Hey, we're rocking and rolling. But here at the very end, this says yes. NPN valid, current plan your own. All right. But what if yours says no? How do you fix that? That's going to be the question. So here is what you're going to do. All right, so it took me a while to figure this out, but here's what happened. Why is my NPN not listed as validated on the agent broker registration completion list? That's the question. So here is the answer. And just in case, if you want to look this up yourself, I will have the links to these two sites on the description down below. All right, so let's figure out why. Okay, so it's probably not listed. Okay, so let's just read this thing straight out here. So the RCL has an NPN validation column to indicate if an agent or broker's NPN has validated by being checked against the NIPR database. A valid NPN with an active license status and CMS Health-approved line of authority in your resident states are required to receive a yes. Agent brokers with a no in that current year are considered not validated. So what does it mean if it says no? Some of you guys would be like, oh, I'm not certified, I'm not going to get paid. It's not that big of a deal. It could be. If your NPN cannot be validated, your contact info will be removed from the Find Local Help section on HealthCare.gov. And you will not be able to participate on Help on Demand. That's all that it means, guys. So you're wondering what the hell is Help on Demand? So when a client goes to HealthCare.gov and they're trying to self-enroll, and they're like, man, this is too hard, too complicated, find local help. What will happen? Excuse me, guys. I'm still recovering from COVID. What happens is they have your area and it gets routed to an agent that's in their area based on their location. And then you as the agent, you get a notification by email and by text. You have to log in and claim it. And you have 15 minutes to do that. Otherwise, it goes to the next agent. If you claim it, you get their contact data, you call them and you help them out. And then you take credit and you're the agent of record, you get paid on it. So if it says a no, you're not going to participate. Okay. So your NPN may not be listed if a typo, an incorrect license number, or an incorrect NPN was entered into your agent broker profile. So when you went in there and registered and you did this, and maybe you had a typo, incorrect license number, or maybe the name is not matching. Okay, I've seen that. Maybe you got married, you got a new name. Maybe you got divorced, you got your maiden name. Whatever it may be, if it's not matching, gonna have a problem. or possibly you have an inactive or an expired license. Well, you shouldn't be selling insurance if that is the case. Okay. If the data that you put here on the agent broker profile does not match what's in NIPR, the National Insurance Producer Registry, NIPR.com, then you have to fix it, make it match, okay? And then you should get a yes on there. If you still have a problem, here's the email to call, and then do your thing. There's not a phone number. That's an email to call. Really, an email, the email for you to email them and send them your issue, and hopefully they can take care of it. Aside from that, that's all you can do. Guys, I will post a link to the full video on the new agent certification, the returning agent certification. Also, if you click on the more down below, you're going to get some goodies of mine that I have for you. Got to buy them. It's an ACA 101 course. Number 2, I have my agent CRM. If you do nothing and you don't have a CRM, this is the one thing you have to get. Use my link. You will get all of my ACA, Medicare, life, dental, vision, auto, and home workflows that I've created in my agency. We're revamping them right now. We're getting them even better. Okay. If you're wondering what's a workflow, first of all, the CRM is a contact manager. It's going to contact your clients by text, email, phone call, voiceless ringwell, whatever you want to do. It records everything. It timestamps it. If you ever have an E&O issue, it's a great thing to have. Number 1. Number 2. Okay. Number 2, I've created workflows. These are jobs. Okay. I had one job that worked yesterday. It's going to make me about $800 and I did nothing. Okay. I had a client that was an ACA client. He's turning 65. The system is set up to look for them when they turn 64 and a half. And then it sends them emails. It also notifies me, but I must have overlooked it. I've been traveling a lot this summer. And the guy calls me yesterday. And he's like, hey, Luis, I'm turning 65 in September. I did what you told me in the emails, and I went to Social Security and I enrolled in Medicare Part A and Part B. I was like, yes. Okay. I got his information. I had an intake sheet already where I had all his data. I verified it. Okay. I had to update the address because it was a little old. I called United. United said, hey, I got his info. Can you tell me if he's got an MBI number? They're like, yep, he sure does. I got it. They gave it to me. I got the effective dates. Call him back. Let's rock and roll. Good. I got a new to Medicare enrollment. That whole process was done with my turning 64 and a half new to Medicare workflow. I've got all kinds of workflows for enrollments, for leads that come in, cross sells. Man, we're always thinking of workflows that cash flow for you. I also got a link to my partnership that I've done with Alex Branding from Agent CRM, Oscar Gonzalez from Scale My Media or Scale My Social. And what we're doing, guys, is we put a package together for y'all for a Medicare 101 webinar in the box. If you want that information, click down below. I'm going to make an ACA one, an ACA version of it very, very soon. All right, guys. So I've got that for you. Hopefully this works out for you. If you got any problems, comment below. I do respond to them myself. Nobody else does it. Okay, I get the emails that I have a comment. I go in there and I respond to the best that I can. But like my video, subscribe. I'm trying to get to 10,000 subscribers by the end of the month. So help me out here, guys. It's growing and I definitely would appreciate it. Thanks again.